Hi, my name is Michelle Trotter and I'm Business Development Specialist here at Eagle Analytical Services. Here at Eagle, we are closely monitoring the coronavirus pandemic and taking it very seriously. We will continue to stay open during our regular business hours to make sure that your patients receive the medications that they need. We are not expecting any delays, but if we do, we will let you know through our email, social media, and also on our website. We have set up an information system to answer any questions that you might have about the coronavirus, and our Eagle experts are answering those questions for you. This week, we have received a couple of questions from you, and we have our Eagle expert in Washington, D.C., Dr. David Husong, who's going to give us some scientific advice. First question, what is the recommendation for PPE, especially gloves, for pharmacists in the community setting? While we have some supply, we anticipate running out before the pandemic starts to flatten. We are encouraging hand washing, distancing, and disinfecting at least hourly. We have instituted curbside pickup and drop-off for our patients.
So wearing of gloves is probably a very good idea. They can be periodically wiped with a disinfectant, and that would help conserve the supply of gloves. The distance that you keep from the patients who are coming in for medications is also important, and the use of a curbside drop-off and pickup is a very good precaution. As for wearing a mask, I think that's possibly unnecessary unless the patient is showing some signs that he may be a COVID patient in this. However, there's an image issue associated with wearing a mask, and that might not be the best encouragement. However, again, pandemic increases in your community, you may need to start wearing masks when dealing with this. You can check the state's reporting database. CDC provides that information as well. Meanwhile, just hand washing and keeping a distance should be adequate until there are cases in the community. Again, check with CDC. Gloves add more protection and definitely are needed when there are cases in the community. So I would say that the best thing to do is to engage in hand washing, counter disinfection, and keep an appropriate distance.
Thank you, David. Another question that we received is this: has there been discussion of allowing compounding pharmacies to prepare isotonic IV fluids during the national emergency? I thought I read that FDA was allowing it, but I can only find articles related to them allowing compounding of hand sanitizer. We're trying to look ahead toward the saline shortage and figure out the best way to use the resources at our disposal.
Well, I've not heard anything from FDA officially about preparing isotonic solutions related to this emergency. The preparation of isotonic solutions, particularly sodium chloride injection, is allowed under the 503B regulations. And so that would not be a problem for a 503B to prepare that, because sodium chloride injection is on the drug shortage list and has for over a decade. The 503B regulations are more recent and would allow that. The pharmacies, the 503Bs, can distribute saline, for example.
We asked David Husong if he had any other advice for compounding pharmacies during this coronavirus pandemic, and this is what he has to say.
Compounders to understand that they too have to engage in social distancing while they're doing their work in the pharmacy. This may require changing shift schedules so that fewer people in close proximity to each other. And again, soap and water is one of the best things that can be used easily. The use of disinfectant materials, hand rubs, they too will be in short supply, but as long as you have them, they're very effective. Beyond that, if you're dealing with the public, keep in mind distance is important and frequent disinfection.
If you'd like our Eagle experts to answer any questions you might have about the coronavirus, you can submit your questions through our coronavirus fact check form on our website,